is with great pleasure that I invite you today to our second annual Thought Leadership Forum. This year we've got a very interesting topic in this forum, that is sustainable healthcare in Hong Kong, the challenges ahead.
We're very lucky to be in Hong Kong. I think probably Hong Kong is one of the best places in Asia to be with the quality of the healthcare that we have.
I think most experts in public health or statisticians would predict that the financial sustainability of the present system is in doubt, in about 10-20 years.
I think this is one of the areas where the whole small government, less regulation, free market does not hold because of the critical nature of health and the information asymmetry that you actually see across the sector.
What is the actual relation between the patient, the doctor, and the hospital? It's very ambiguous.
Accountable care really is looking at it like a healthcare model essentially that is data-driven and value-based. So you're looking at what you provide and how you provide that and what sort of outcome that you get. So the outcome becomes the focus and how you risk share across that.
It's time, I think, for the transparency. As Dr. Ng said, where's the money going? Down to the service level. Are we seeing a proper tendering process?
Definitely the collaboration between the government in order to remove the strain on the government services has to be with the private sector. I like also the idea of tender and insurance can be incorporated in that.
This growing need of aging population, right? Right now, there is nothing in the private sector because the things that you mentioned are all disease-based.
And something which I think is totally lacking in Hong Kong is managed care. Managed care is probably the way, because managed care can be done in the private sector, and the private sector then can be a benchmark even for government hospital.
You don't need to look far, right? If you just go online to US and type out open data, you can get all the charges for all the procedures. Whether you agree with it, they're high or low, I think that's not the issue. I think the market will adjust. But at least you show what is available.
I think what the public needs is really assurance of quality, safety, and also the price transparency.
So again, I'd like to ask everyone to thank our panelists for coming today. I'd like to thank them for taking the time to come along and share their expertise with us and to discuss both the challenges and the opportunities facing Hong Kong's healthcare system going forward.